It does not begin with pain, and it does not begin with a lump that you can immediately notice. Cancer begins silently, deep inside the microscopic world of the human body, inside a single cell whose internal rules begin to break. To understand cancer clearly, we need to zoom in and explore how a healthy cell lives, how it dies, and how a single mistake can transform it into the beginning of one of the most complex diseases known to medicine. The world inside a cell. Your body is made of trillions of cells. Skin cells protect you. Blood cells carry oxygen. Muscle cells enable movement. Nerve cells allow thought and memory. Every cell has a nucleus, which contains DNA, the instruction manual that tells the cell how to grow, when to divide, how to repair itself, and when to die. A healthy cell follows these instructions precisely. When it becomes old or damaged, it activates a controlled self-destruct process called apoptosis, ensuring it does not cause harm to the body. But cancer begins when a cell stops following the rules. How DNA becomes damaged every day. Your DNA faces threats that can cause mutations, small changes in the genetic code. Common causes include ultraviolet light from the sun, chemicals in cigarette smoke, radiation exposure, pollution, alcohol, chronic inflammation, viruses that insert their own genetic material into cells, errors during cell division, natural aging. Most of the time, the cell detects and repairs DNA damage. But when the damage is too severe, or when repair systems fail, the instructions that control the cell's behavior become corrupted. A mutation that affects a gene controlling growth, division, or DNA repair can cause the cell to malfunction. This is the spark that begins cancer. The first abnormal cell. Imagine a single cell somewhere in the body, perhaps in the lungs, the breast, the colon, or the liver. It looks almost normal under a microscope. But inside, a crucial gene has mutated. The mutation allows the cell to divide more quickly, ignore signals telling it to stop, avoid apoptosis, and continue surviving even when it should not. At first, nothing seems wrong. You feel healthy. The cell is too small to cause symptoms, too small to see on scans. But silently, it begins dividing. 1 becomes 2. 2 become 4. 4 become 8. This tiny group of abnormal cells is the beginning of a tumor. A small cluster becomes a tumor. Over weeks or months, the cluster grows. A few hundred cells. A few thousand. Still invisible, still silent. As the cluster expands, some cells develop additional mutations. Some become faster at dividing. Some become better at surviving low oxygen levels. Some learn to hide from the immune system. The cluster becomes a small ecosystem where the most aggressive cells begin to dominate. Eventually, the mass becomes large enough to push against surrounding tissue. This is when it becomes a tumor. Not all tumors are cancerous. Benign tumors grow slowly and stay in one place. Malignant tumors invade surrounding tissue and spread. Cancer refers specifically to a malignant tumor, one that breaks boundaries. A tumor needs fuel to grow. A tumor cannot grow beyond a small size without oxygen and nutrients. Healthy tissue receives nutrients from well-organized blood vessels. A tumor, however, must create its own supply. To do this, cancer cells release chemical signals that convince nearby blood vessels to grow into the tumor. This process is called angiogenesis. Under a microscope, angiogenesis looks like thin, fragile new blood vessels branching into the growing mass. These vessels deliver oxygen and nutrients that accelerate tumor growth. With its own blood supply, cancer can grow faster and deeper. Invasion. When cancer breaks through its boundaries, healthy tissue follows structure and organization. Cells remain in their assigned locations. But cancer cells no longer respect boundaries. As the tumor grows, its cells release enzymes that act like molecular scissors. These enzymes break down surrounding tissues, making it easier for cancer cells to push through. This process is called local invasion. It is the key difference between a harmless benign tumor and a dangerous malignant one. A benign tumor stays where it started. A malignant tumor spreads. Metastasis. The most dangerous stage, the deadliest feature of cancer is its ability to metastasize, to spread to distant parts of the body. To metastasize, a cancer cell must complete a nearly impossible journey. Detach from the main tumor, invade surrounding tissue, enter a blood vessel or lymphatic vessel, survive the hostile bloodstream, exit into a new organ, grow into a new tumor. Most cancer cells die during this process. But the few that survive become the seeds of metastatic tumors. Metastasis explains why cancer can appear in the brain, the lungs, the liver, the bones, lymph nodes, multiple organs at once. Once cancer spreads, treatment becomes much more difficult because each metastatic site may behave differently and respond differently to therapy. How cancer affects the body as a whole. As cancer spreads, symptoms become more noticeable. Chronic fatigue, unexplained weight loss, persistent pain, digestive changes, difficulty breathing, frequent infections, lumps or swelling, neurological issues. Cancer consumes energy rapidly, pulling glucose and nutrients away from the rest of the body. Inflammation rises. Organs struggle to function. The immune system becomes exhausted. Cancer is no longer a local problem, it becomes a systemic disease. How cancer is diagnosed. Doctors use several tools to detect and diagnose cancer. Blood tests to identify abnormal markers, imaging, CT, MRI, ultrasound, to find tumors, biopsies to examine tissue under a microscope, molecular tests to identify mutations. Early detection dramatically improves treatment success. How cancer is treated. Cancer treatment depends on the type and stage. The main methods include surgery, removing the tumor, chemotherapy, destroying rapidly dividing cells, radiation therapy, using high-energy beams to kill cancer, immunotherapy, helping the immune system fight cancer, targeted therapy, blocking specific mutations, hormone therapy, slowing cancers that depend on hormones, precision medicine, customizing treatment to an individual's tumor. Modern cancer therapy often combines multiple methods for better results. Hope through science. Research is advancing rapidly. Liquid biopsies can detect cancer DNA in blood. AI can find tumors earlier in scans. Immunotherapy is becoming more effective. Targeted drugs are more precise. Genetic testing helps patients choose the best treatment. While cancer remains complex, science is moving closer to earlier detection, gentler treatments, and better survival rates. Final message: cancer begins with a single cell that stops following the rules. From that small beginning, it can become a local tumor, and eventually a systemic disease. But understanding cancer, how it develops, how it spreads, how it can be detected, gives us the power to take action early and protect our health. Medical disclaimer: this video is for educational purposes only and does not replace professional medical advice. Always consult a doctor or qualified healthcare provider for any concerns about your health.